I have the honor to invite Professor Dr. Omer Hasan Kasule. He is the invited speaker for today's session in our certificate course on essentials of ethics and professionalism in healthcare in an Islamic perspective. Professor Dr. Omer Hasan Kasule is a renowned, world-known figure, particularly in integration of Islamic values to the medical education and practice. And he has pioneered this project in Brunei and Malaysia for many years, where he worked for more than almost 1.5 decades. He had graduated from Uganda and then had his postgraduate medical education, first master's in public health from Harvard University, and then doctorate in public health from Harvard University, and subsequently worked for almost 10 years in different institutions in the United States of America. And he also had certification in Arabic and Islamic studies from Bilal Institute in Kampala, Uganda. And then he worked in Malaysia with the International Islamic University, then in Dar es Salaam, Brunei, where he had critical input to integration of the Islamic values to the medical education. Currently, he is professor of epidemiology and bioethics at King Fahad Medical City, and he is chairman of the Research Ethics Committee at the King Abdullah bin Abdulaziz Hospital in Riyadh. I'm thankful to him that he, despite his busy schedule, he has accepted our invitation and would be speaking to participants of the certificate course by Riphah International University this morning. I request Professor Omer Hasan Kasule Sahab to start with his presentation and talk for the participants. Professor Dr. Omer Hasan Kasule.
Shukran, Jazakallah khair for the introduction. Bismillah wa ala barakatillah wa salatu wa salam ala rasulillah أدى الأمانة وبلغ الرسالة ونصح الأمة وجهد في سبيل الله حق جهاد جزاه الله عنا أوفر الجزاء. Sisters and brothers in the Islamic Republic of Pakistan, it's a pleasure talking to you this morning about the important subject of professionalism, and even more important, how to look at it from the Islamic point of view. I will be reviewing professionalism in general, and will show the various views about it and practices. Then I will explain the Islamic perspective. Now, I will be defining professionalism, its dimensions, and how it is taught. Then I will talk about principles of medical ethics, because you cannot be a professional without following these ethics. And again, I will talk about the ethics from the Islamic perspective. Now, I also have case scenarios, actual case scenarios that we'll be discussing. I will be showing you the case scenario, and maybe you will be giving me your opinions and points of view on the chat. Now, we need to know, as we talk about ethics and professionalism, that there is an inner and outer dimension in a person. Some things are inside, we cannot see them. But what we see outside reflects what goes on inside. Now, ethics and professionalism are closely related, but it's difficult to define them. In my view, ethics is the inner dimension. That's what drives you inside, in your heart. And professionalism is the outer dimension. That's what we see in the behavior that you are behaving in a professional way. Now, sometimes there's a disconnect between the two. Somebody with bad ethics may behave well because he's afraid. People are watching him. So it's difficult to police ethics because they are inside the heart. But the consequences of bad ethics in terms of professional behavior, those can be detected. So as we said, professionalism is the outer dimension. It should be easy to police it, to monitor it. Problem is it's difficult to define professionalism, as I will be showing you. Now, I want to talk about a conceptual issue here, very important. When we talk about ethics, ethics means the right and wrong. And then we talk about law, legal and illegal. Now, there is a very complex relationship between ethics and law. And there's a difference between the Islamic and Western perspectives. So we shouldn't be confused. In Islam, what is right is legal. Okay? And what is wrong is illegal, it is haram. But in the Western perspective, there are certain things that are right and could be made illegal. The law can make them illegal. Islamic law is very consistent that whatever is not ethical is haram. What is ethical is halal. There could be a few exceptions, but these are because of darura. So in the Islamic law, when we say something is ethical, it means according to the Sharia, it's right. But in the Western perspective, no. It could be unethical, but the law could say it is legal. Now, let us look at a case scenario just to tell the difference between professionalism and ethics. See, physician A was called in for consultation. He assessed the patient and told physician B, who is the attending physician who invited him, that the patient needed ultrasound because of possibility of an acute abdomen. Physician B, quoting official hospital policy, disagreed, saying that if an acute abdomen is suspected, a general surgeon should be called in. So physician A suddenly started to raise his voice with a high tone and shouting in front of patients, humiliating the other physician. And then he left. Now, physician B was left wondering, this attitude is affecting me as a healthcare provider, shouting and disrespecting me in my workplace. Why does he do this to me? So you see, that behavior is not professional, is not ethical, but I would like you to answer me in the chat what you think about this issue. Is it ethics or is it professionalism? Write for me in the chat and I will be commenting on what you write. Now, let me attempt a definition of professionalism. Really, professionalism is attributes and behaviors of a physician. The good professionalism, what is expected of a good healthcare provider. Now, we can agree fairly 80 and 90% that there are tangible behaviors that are professionalism. We can agree that if somebody behaves like this, tangible, seen, that's professional. But then there are other things that we cannot see because behaviors are easy to observe. You can measure. But attitudes, which and other intangibles in professionalism, these are things that the senior physician passes on to the junior physician. Maybe you cannot write them, you cannot see them, but they do exist. Attributes and attitudes, you learn them. It's like a culture. There is a culture of being professional. You learn it by being with good professionals. It's difficult to learn it from a book. So, which means, as we define professionalism, the intangibles, there are certain things that cannot be written, cannot be seen. But a young medical student working with a good professor will pick these up automatically. See? Now, some of these things is when an issue happens and all physicians and professionals react in the same way, but they don't have to discuss it to reach the agreement, or they don't have to read a book. It means there are certain intangible aspects that we automatically have. And these intangibles are what sometimes are called trade secrets of phronosis, practical wisdom. As you work longer in the hospital with good people, you pick up a lot of professional attitudes and intangibles. They are not written in the book. but they are there and they're very important. And that's why, as we'll explain later, we learn professionalism through apprenticeship. You work with professional people and you automatically pick up a lot of intangible behaviors that are not written, but you pick them up. So these intangible aspects of professionalism, actually, they correspond to the fiqh concept of urf, or custom. In the book, Al-Ada, Majallat al-Ahkam al-Adliya, Al-Ada, which is custom, Al-Ada muhakkama. Custom has got the force of law. So there are certain things that are customarily done automatically in the hospital. They are not written, but they are very important and they are part of professionalism. So I want you to understand that professionalism could be defined things. Do this and this, don't do this, don't do that. But there are other things that you learn by being in a good environment. We can also define professionalism as skills, but this is a weak definition. It's more important to define it as behaviors and attributes, because a long time ago, skills was a very important definition of professionalism. But now we have got a lot of quality programs to make sure that skilled care is given. So we pay less attention to the skill dimension. Now, I want to come now to the Islamization part of professionalism. I will start by giving the dimensions of professionalism as perceived in the West. There are many formulations, but I will talk only about the one from the American Board of Internal Medicine. The American Board of Internal Medicine, ABIM, says that there are 6 dimensions of being a good professional. Altruism, putting the interests of the patients ahead of your own interests. Accountability, hasaba, you feel accountable for what you do. Excellence, you attempt to, in whatever you do, to achieve excellence. You fulfill your duties. You have honor and integrity. You are honest, sharaf, and then you respect the others. So those are the 6 dimensions of professionalism as defined by the American Board of Internal Medicine. Also in many Western countries, they follow these or a little bit more, a little bit less. But I have got a problem with this Western formulation of professionalism. Let us talk about the negative dimensions as mentioned by Abim. Then I will talk about my criticism. Abim gave us 6 dimensions of good professionalism, but also they gave us dimensions of bad professionalism. See, attitudes, behaviors, and actions that erode professionalism. These are the following: abuse of power, sexual harassment, conflicts of interest. You see, you put your interests before those of the patients. Professional arrogance, you feel you are special because you're a doctor. Physician impairment is very important. You may have a problem. You may have a mental problem. You may have a physical problem. You may have advanced disease. You need to be aware that you are impaired and you're not supposed to practice. Also, fraud in research. This happens a lot of times. So they define the positive dimensions and negative dimensions. And this definition is very influential all over the world. But from our Islamic perspective, we are not very happy with it. And these are my criticisms. The Abim formulation is very practical and very pragmatic. It's the American way. It gives us both the positive and the negative, and there is little room for ambiguity. But it's not exhaustive. See, the lists that are mentioned as positive and negative dimensions, they don't mention everything. So it's not a very exhaustive list. And it has no statement of underlying moral theory. And this, again, the problem with the secular Western approach, that morality, which comes from religion, is not considered. But you need and moral theory in order to be able to cover especially the intangible aspects of professionalism. So because of these weaknesses, we need to formulate dimensions of professionalism from our Muslim perspective. That's what I'm going to attempt to do in the next slide. So I did write and publish an article on this. It's being quoted widely. Alhamdulillah, I'm happy that our brothers are beginning to use the Islamic perspective. So I think that professionalism has got 7 dimensions. The first is Iman. So this is the basis of our life. If you don't have Iman, you cannot be a good professional. You may do things well because you're afraid or you want to be rewarded. But if it's not based on Iman inside the heart, it is fake. And sooner or later, you will be unprofessional. The next one is consciousness, taqwa. Taqwa is in Urdu and in English, the root word. In Urdu and Arabic, it implies being afraid. But actually, that's not understanding the word taqwa. Taqwa of Allah subhanahu wa ta'ala is not afraid. Because afraid, if a tiger appears, or if a snake appears, that is fear. That's, you are afraid. But when we are dealing with Allah subhanahu wa ta'ala, taqwa is between fear and hope, because Allah is kind to us. We hope that He will forgive us, He will help us, He will support us. But we don't want to annoy Him because we love Him. So taqwa from the Islamic perspective is both love and fear, but both of them are within the context of love of Allah subhanahu wa ta'ala. We want to please Him. We don't want to annoy Him because we love Him. Okay. The third dimension, Islamic dimension of professionalism, is best character, ahsan al-akhlaq. And the akhlaq are well defined in many hadith of the Prophet ﷺ. Imam Nawawi did mention 33 hadith that are the basis of Islam. Those hadith summarize the akhlaq, the characters that a Muslim should have. Even the book of Imam Nawawi, that is read a lot, Riyadh al-Salihin, is a very common book. The hadith there are many, but they summarize the akhlaq that a Muslim should have. Now, the fourth dimension is excellent performance, itqan al-amal. As the Prophet said, إِذَا عَمِلَ أَحَدُكُمْ عَمَلًا فَلْيُتْقِنَهُ. When you do anything, do it well. So you want to do a surgery very well, to the extent that after a long abdominal operation, as you are closing, if you see a very small bleeder down there, open and close it. It will take more time, but don't leave that bleeder there. This is part of excellent performance. Now, the fifth dimension is ihsan. We always try to improve, to go to the highest. It's very important for us to realize that ihsan is a fundamental of our religion, and it's the highest one. Islam has got 3 fundamentals, usuluddin thalatha. The first one is shahada, kalimat shahada, la ilaha illallah Muhammadur Rasulullah. That's the lowest. So when you enter Islam, you say la ilaha Muhammadur Rasulullah. At a higher level is iman, which has got 6 pillars. So you start with Islam, then you get to iman. But higher than iman is ihsan. And the Prophet defined it, أن تعبد الله كأنك تراه فإن لم تكن تراه فإنه يراك. You worship Allah as if you are seeing Him in front of you, because you know, although you cannot see Him, He's seeing you. It means that the physician, you are with the patient, you are inside the abdomen. You may do things in a rough way, an incorrect way. Maybe nobody will see you. No human will see you and blame you. But if you know that Allah subhanahu wa ta'ala is watching you, you're going to do it right. So that's the meaning of ihsan. We need to actualize ihsan in our professional practice, knowing that it's the highest fundamental of our religion. Then the next dimension is responsibility, amana. And then self-accountability. You check yourself before others check you. Hasibu anfusakum qawlan tuhasabu. Check yourself. Whatever you do, ask the question, have I done it right? Is this the right way? So this is muhasabat an-nafs. Now we'll talk a little bit more about these Islamic dimensions. Now, Iman will improve your professionalism in two ways. One of them is holism. Because if you believe in Allah subhanahu wa ta'ala, you're going to look at the whole picture and not a specific picture. In the secular culture, people look at a patient and not the whole dimension. Like this, the orthopedic surgeon, when a patient walks in, they will look at bones, but they don't realize this is a human being. He has got a family. He has got fears. He has got concerns. So they may not treat him as a whole person. They may treat him as bones. So Iman enables to develop this holistic aspect of the patient and not just the area of the body you're interested in. It also teaches you humility. You are a physician, you are very clever, you went big universities, you can make people sleep, wake them up, do anything, cut off their organs, replace them. Sometimes Shaitan tells you, you are too powerful, you are special. So there's a lot of arrogance in our profession. But if you've got Iman, you will have the humility to know you are just a simple person. Now, why do we talk about holistic medicine from Iman? It's the doctrine of Tawheed. Tawheed is an integrative doctrine in Islam. It's the most important doctrine in Islam because there is Tawheed al-Rububiyyah. There is one creator for the whole universe. It means everything in the universe must fit with one another. That's integration. So if you have got Iman, you know that from Tawheed, everything that happens to a patient must fit. His salah, his family, his hopes, his fears, you must deal with them in an integrated way. Don't just deal with the patient as pathology. It does actually happen. A gynecologist seeing a woman walking in, they may not look at the woman as a whole. Actually, they don't even look. The patient may be wearing shoes of different colors, which is something surprising. The patient may even be crying, but they don't care because they know this gynecology, they know the organs that they deal with. When the patient sits down, they ask about those organs, treat them, and let her go out. But this patient has got other problems. If you had an integrated approach, you would have asked her, how are you? How is your family? Does anything bother you? Then she will tell you. And then you can help treat her in a more integrated way instead of thinking only about the reproductive organs. Now, Iman makes you humble because you realize that you are an agent and not the cause of cure. See, many doctors walking around, see that man walking over there? If it wasn't for my surgery, he will be dead today. I saved him from life. Actually, many doctors say this and they really believe it. This is extreme arrogance because Allah was Shafi. Allah is the one who cures. You as a doctor, you are just an agent within Allah's qadr. Your treatment may work, may not work. It all depends on Him, Allah subhanahu wa ta'ala. As Quran says, وَإِذَا مَرِضْتُ فَهُوَ يَشْفِينِي. When I fall sick, cure is from Him, not from the doctor. But the doctor is the agent through whom Allah's cure comes. Now let us talk about taqwa. This is the next dimension, Islamic dimension of professionalism. Taqwa makes you conscious of your duties and very careful in performance, because you know that Allah subhanahu wa ta'ala is watching you. There is a story told that in Medina, Sayyidina Umar ibn al-Khattab had forbidden adulterating milk with water, because the milk traders used to add water to the milk to increase the volume. There was a woman in Medina who was doing this business. So at night, she would add water to the milk. So the daughter, see the people brought up in the clean Islamic environment, the daughter told her, Mama, Omar said we cannot add water to milk. The mother said, Omar is not here. He will not see us. The girl said, إذا كان أمير المؤمنين لا يرانا فرب أمير المؤمنين يرانا. If the leader, Omar, cannot see us, the Lord of Omar is seeing us. She was conscious that Allah subhanahu wa ta'ala is watching them. They were in their house. It was at night. They were adding water. And it's difficult to tell that somebody added water to the milk. Very difficult. But this girl had taqwa. She had consciousness of Allah watching. So this is the level that we want physicians to have as they work. Akhlaq is the next dimension, Islamic dimension of professionalism. Now, in the interaction between the physician and patients and also other professional colleagues, we need to manifest the highest akhlaq, the highest characters. Tawazun, being balanced in your emotional reactions. Humility, being humble. This is very difficult, and I think we need to train ourselves, because you notice a first-year medical student is very afraid. They walk with small steps and very afraid. By the time they're in the third year and they have got the stethoscope, they walk around swinging the stethoscope, becoming proud. By the time they become consultants, they are extremely proud. The way they walk, the way they talk, there's no tawadhu, there's no humility in their voice, in their behavior, in their talk. So akhlaq should teach us humility. We have, as doctors, we have a lot of knowledge. Also, we are clever because they choose the best students to do medicine, but that shouldn't ever make us arrogant. The issue of brotherhood, al-ukhuwa, is another character we need to have. You see, the patient is not a patient. He's your brother. So when you go to the bedside of the patient, you are doing two jobs. There is the technical job, check the heart, order injections. But then there is the brotherhood. You are going to visit a brother, because iyadat al-marid, visiting a patient, is one of the duties. You are supposed to visit your Muslim brother when they are sick. So in the hospital, actually, and I will recommend that sometimes you go to the ward and visit patients without doing any professional work, because you need to remind yourself that these are your brothers and you are visiting them as your brothers because they are sick. Now, social respectability. As a physician, you need to make sure that you are socially respectable. It's called muru'ah. It's a very high order because you are like any other citizen. You're in Karachi, you know, in Lahore. People go through red lights. You're the physician. You say, well, I'm an ordinary person, let me go through the red light. You cannot, because the physician has got special muru'ah. Because of your profession, you have to wait for that red light to change. You have to behave in a way that gives respect to the profession, social respectability. Now, we talked about itqan, which means doing things well, and ihsan, being perfecting things. These motivate you to improve your skills all the time and to keep on learning. In other words, you need to read journals all the time, attend conferences, attend seminars, listen and learn to improve so that you can perform better. Itqan and ihsan. And you need to treat your work as an amana from Allah subhanahu wa ta'ala, because Allah subhanahu wa ta'ala gave us humans amana. The amana, inna ardan amana ala samawat wal jibal. Allah subhanahu wa ta'ala asked the heavens and the mountains and the angels to carry this amana. They couldn't carry it. Quran tells us, وَاشْفَقْنَا مِنْهَا. They found it very difficult to carry the amana. وَحَمَلَهَا الْإِنسَانِ. But the human being carried the amana, you know, and Quran says, ظَلُومًا جَهُولًا. The human being carried it, he transgresses and he's ignorant. So you need to realize that this profession is a responsibility, it's a trust that you carry. And you have to make sure that you do it well with sincere intentions, ikhlas and niyyah, quality work, itqan and ihsan, which you talked about, and social responsibility, that as you practice in the hospital, you realize that problems don't come in from the hospital, they come from the society. See, if you are fixing broken bones because of domestic violence, don't just keep on fixing those bones for 20 years of your professional work. You need to think, why do people come in with broken bones? The problem is in the society. So you need to understand you've got a social responsibility, and part of your work should be outside the four walls of the hospital to treat problems in the society that bring people into the hospital. Now, this professionalism is a social contract. It means you have got a responsibility to society. I need to be aware of that. So those are the 7 dimensions of professionalism from the Islamic perspective. And I think I would argue to change and use this instead of the dimensions of the American Board of Internal Medicine, because these ones reflect our religion, they reflect our culture, and we understand them. It's easy to apply them, and inshallah we can improve and be better professionals. Now, let me look at the chat. Maybe somebody has a question. Yeah. Okay. Now, there is a question here that by intangible, do you hear mean conventions of a profession? Yes. Intangibles are conventions, cultural things, but they are not written. You just learn them by being within the profession. So they are not, some of them are not some that you can touch and define, but you pick it up because you are in the profession. So you are right. Now, striving towards perfection, yes, brother says, this seems to be cross-cutting across all other activities. Yes, we try to strive to reach perfection. Al-Kamal Lillah, absolute perfection is from Allah subhanahu wa ta'ala. We humans can never reach 100%, but we try our best to perfect whatever we do as much as we can. Okay, we'll continue. You can write more comments and questions in the chat. Now, how do we teach professionalism? See, medical schools are realizing that professionalism is very important. So because of failures among medical students, professionals, they have introduced professionalism training in the medical training. And medical schools are struggling to develop a culture of professionalism using various strategies. Some of them teach ethics, some of them even teach humanities. But we'll again look at an Islamic approach to doing this. And I think we need to start teaching about professionalism as early as possible in the medical course. Start from year 1, because once they pick up bad habits, if they see a senior physician abusing patients when they are in the first year, if you teach them in the 4th year that you shouldn't do this, it's too late because they have already picked up a bad habit. So we should teach them very early to make sure that they don't pick up bad habits. Now, how do we teach? It should be passive as apprenticeship. This means that professionalism is not taught as lessons in the classroom. It's really senior doctors behave in a professional way, and the young ones who are the apprentices, they learn from them. So the teaching is passive. And apprenticeship is the best way of teaching professionalism. I don't believe that you can give a lecture on telling the truth or being kind, because in one ear, out the other ear. But when they see it, it's very good. Our problem is, if we are going to teach professionalism by apprenticeship, means the students learn from senior doctors. Not all the senior doctors are good. Some are not professional. Others are professional. So we have to be careful that our students, the young students, we distinguish among our consultants. We allow some of them to work with them, to teach them, and let other consultants do the service, teach the patients, because we don't want the unprofessional ones to pass on bad behaviors to our students. Now, so that's the problem. We need to have good role models. And you need to remember, Yawm al-Qiyamah, people may ask you that you committed a mistake. You had a patient. Where did I hurt the patient? They give you a name in, any province of Pakistan, a small village, unknown village. You say, I never went there. Allah will tell you, yes, you went there. You know what happened? You were a consultant and you didn't work in a professional way. And a young student watched you and they learned that bad habit from you. 20 years later, they became doctors in that village and they did unprofessional things. So there is a sin for the young person, but also you share in the sin. As the Prophet said, Man sanna sunnatan hasana, falahu ajru wa ajru man amila biha. If you start a good behavior, a good precedent, you get rewarded, but also you get the reward of those who copy it and use it, those you teach. And then he said, Man sanna sunnatan sayyi'ah. If someone does something wrong, a bad precedent, falahu wizruha wizru man amala biha. You will get the punishment for doing something wrong, but also you'll get the punishment from what those who learned from you did. That's why you can be punished Yawm al-Qiyamah for something done in a remote village in Pakistan where you never went. But your student went there and repeated something bad you taught him. So this is the sort of responsibility that we need to have. Now, the other teaching methods of professionalism, I'm going to send this PowerPoint so you can look at it. I don't want to go through them because I want to emphasize apprenticeship. We learn from good role models. We need to make sure that our hospitals have got good role models to teach the students. And as we teach professionalism, I want us to revive the Islamic holistic educational tradition. Islamic education traditionally, and I think we still have a lot of it in Pakistan today, a student goes to a sheikh and stays with the sheikh during the day, during the night, prays with him, eats with him for several years. And then at the end of that time, the sheikh will give ijaza, it's a sort of a certificate that, okay, now you have learned, go and teach others. So it means our madrasa system really teaches through apprenticeship. The teachers and the students are together all the time. They are passing on culture. And I think this system was very effective on passing on knowledge, passing on ethics and behaviors and attitudes across all the generations, because the student is with the mentor all the time. It's not just teaching in the class. You stay with your teacher all the time. Also, the mentor, the teacher, has time to observe the student, see bad character in him, and correct those characters. I think this traditional Islamic approach needs to be revived in the hospital system, that really we stay with the students, make sure we behave well, and let them learn from us as their mentors. And this is the type of thing that the Prophet ﷺ talked about, the Quran talked about. You know the story of Musa and Khidr? Musa one time was asked a question and he answered it correctly. Somebody asked him, who is the most knowledgeable person? Musa answered, I am the one, which is true. He was the prophet among Bani Israel. He was the most knowledgeable. He wasn't just arrogant. He was telling the truth. But Allah wanted to teach him that there are people more knowledgeable than you. So Allah told him to look for this man called Khidr. And you remember the experiences they had. Musa traveled with him. The man did things. Musa learned. The man did things. At the end, the man explained to him what he had done and why he did it. So Musa left with the deep ethical lessons from Khidr. But he learned it by apprenticeship or accompanying him and being with him all the time. Also, the Prophet ﷺ in Mecca, in Dar al-Arqam, he was teaching by apprenticeship, because every morning the Sahaba would gather in Dar al-Arqam, which to us is the first university in Islam, and they spend the day with him. He would teach them one by one, teach them in groups, would observe them, see what is wrong, correct it, and they learned from him. Actually, Darul Arqam was such an important education institution that the Prophet ﷺ limited the class size. There are people who used to accept Islam and come to Mecca. He wouldn't let them join Darul Arqam. He told them, okay, go back to your tribe. When you hear Islam is victorious, come. Why? Because the Prophet wanted to make sure that the people in Darul Arqam had enough time to learn from him very well, to have deep knowledge of Islam, because they are the ones who are going to be the agents of change in the society. So alhamdulillah, this method of personal, one-to-one apprenticeship training worked very well in our history, even the Quranic tradition. And I think we need to revive this. But how do we revive it? The beginning is we need to separate service from teaching. I think consultants who are religious, who are ethical, who are professional, should be the ones to teach medical students. The other consultants can do service, they can treat patients, but we shouldn't allow a consultant who can pass on bad character to teach students. The second thing is we need to do service while teaching. As we work, we teach. See, when you examine patients, do it in the right way so that you are teaching them and you explain to them what you are doing. And we also need to make sure that the consultants we choose to teach clinical students should have a reduced clinical load. Unprofessional habits occur because of the time pressure. You have got a line of 100 patients in front of you, so you don't do things well. You don't take a good history. You don't make a good examination. You write a prescription before making a full diagnosis because you have to finish that line. So what I mean, the consultants or professors who are teaching students professionalism should have a lower clinical load. They should have fewer patients so that they are not pushed by time to do things that are not professional, because that's a risk. The students may pick up those unprofessional things and then we get into trouble. So this is professionalism. We have defined it and we have given the Western secular meaning of professionalism, and we have given the Islamic dimension of professionalism, and we have talked about the way to teach professionalism, which again is a revival of the Islamic tradition of teaching by apprenticeship. Now, I want to talk about ethics, because ethics and professionalism are closely related. As I said at the beginning, ethics is what is inside. Professionalism is what we see outside. So for the outside to be correct, the inside must be correct. So we'll now talk about the ethical principles that a Muslim physician should have. These are from fiqh. Okay. Qaidat al-qasd, the principle of intention. You want to make sure that your inner intentions are clean. This will protect you. A lot of times, you may be an obstetrician, and there is a woman who starts labor in the morning. And you work because you know your son is going to get married in the evening, but because these days you get companies to arrange weddings, you don't have to be involved. You say, well, I will go and attend the wedding like everybody else because all arrangements are being done. But the woman, by midday, progress, but not enough progress. By 4 o'clock, progress slow, but not enough. 5 o'clock, no. Now you are in a dilemma. You have to stay to wait because you know she's progressing and can deliver vaginally. But you have to wait. You may miss your son's wedding. So this is where the intention is. Qaidat al-qasd. If your inner intention is to do good and treat patients, maybe you may go late to your son's wedding. You need to clean the inside niyyah. The second principle is qaidat al-yaqeen. You want to make sure that you deal with certainty. Al-yaqeen la yazulu bil-shak. Don't diagnose without examination, without investigations. We don't guess. Islam wants certainty, yaqeen. Then there is qaidat al-dharar, the principle of injury. It's a very important principle. Actually, all the Western ethical principles fit only one of these Islamic principles, that we are here to give benefit and not to harm the patients. So these are the Western ethical principles. The first one is autonomy of the patient, that all medical decisions are made by the patient or by the doctor. The job of the doctor is to explain what he wants to do, why he wants to do it, disclose everything, but the consent to go ahead is made by the patient. Why? Because the patient will never harm himself willingly. He's the person who is most concerned about his health, so he should be the one to make the final decision. Beneficence, we need to make sure that we are giving benefit. Non-maleficence, we are not causing harm, and justice. So this is a principle of injury. There is the principle of hardship, qadat al-mashaqqa. This means that when we're in a difficulty, the rules that normally apply can be changed. Like in the Sharia, a man should not see a woman, a strange woman who is not, but in a hospital, we may have to do it because we don't have a female physician. This is allowed under the qaidat al-mashaqqa, the principle of hardship. Al-darurat tubih al-mahdhurat. Necessities make what was forbidden allowed. The last one is qaidat al-urf, very important in the hospital. this is a principle of precedent that when you practice, you have to follow the usual clinical guidelines in your hospital. You need to follow the approaches that have been approved by the profession. Don't practice from your whims and fancies. You need to follow the system. The other ethical principles that we need to know, privacy and confidentiality. These are related, but they are not the same thing. Privacy means that around somebody's body is an area that is private. Nobody is supposed to go into that area. You are not supposed to ask people about their private matters. You're not supposed to see their private matters unless they give you permission. Our patients have got their privacy, which we must respect. You cannot go into their privacy without getting their permission. So you always get permission. Then confidentiality. After getting access to confidential information, you have to keep it confidential, secret. We never tell anybody about what we see in patients. Even our spouses. It's one mistake that we make. We go home and tell our spouses about our patients. Never. You don't tell other doctors about your patients if they don't have to know. But if they have to treat the same patient, of course, you have to tell them. So we need to keep the patient secrets very, very carefully. And we need to be truthful. We need to tell the patients the truth. We need to disclose everything and not hide things from them. And we have fidelity. This is a very important principle. We need to be loyal to the patients. In practice, this means that if you're on duty, morning duty, and you have to go home at 2 p.m., the next doctor nurse has not yet come. You are required to stay until that other one comes because your loyalty is to the patient. You cannot do anything that will harm the patient. In the same way, if there's an accident on the highway and people are injured, as a physician, if you come, you're obliged to stay there. Do whatever help you can until the ambulance comes. It's part of our job. We cannot run away from patients. We must be loyal to them and help them until the end. Now, I want to talk about roles in the hospitals, but I will not talk about those. You will see them in the PowerPoint that I will send. We also have got roles in the Ministry of Health. We have got roles in the community, and we've got duties to our patients. So these, inshallah, you can read in the PowerPoint. They are all very straightforward. We have got duties to our colleagues, our nurses and our physician colleagues. There are certain duties that we owe them. It's part of ethics and part of professionalism to fulfill these duties. So you will read them, inshallah, from the PowerPoint. Now, I've got some case scenarios just to drive home the things that we have discussed. I think we're coming to the end of our time. I will read the scenario, and I want you to write in the chat what you think about it. These are scenarios about professional and ethical dilemmas. Now, scenario one, the Minister of Health issued a new policy that all doctors in its hospitals must be engaged in research, okay, and that research will be used in their performance evaluation. So the doctors were very angry. They said, no, we came here to treat patients, not to do research. How can you force us to do research? Okay. How do you solve this problem? What would you say? Okay, write to me in the chat, because the doctors say we even don't have enough time to take care of the patients. Where shall we get time to do research? So how do you solve this dilemma? And it's becoming a common dilemma now in our hospitals. Okay, we'll stop a minute. Okay, the second scenario was that the hospital manager wanted to discipline discipline a physician who was 2 hours late for his cardiac follow-up clinic. Why was he late? Because he was in a community program teaching about prevention of cardiovascular disease, and the community program ran over time, so he was late for the clinic. And the hospital manager was very angry for him being late. What do you think about this? What principle do you use to solve this? Is the hospital manager right to discipline this physician? Was the physician right to delay coming to the clinic? Let's see what people say. Okay. Okay, there are some comments about how to solve the dilemma of research by scheduling so that both of them can be done. Okay, the second scenario is about disciplining this physician. Again, you can write for me in the chat. Now, the third one, the hospital director wanted to discipline a doctor who refused to treat a patient with a repeated myocardial infarction. This patient had refused to give up smoking. He refused to comply with dietary and drug treatments. So he had to come to the emergency room 2 or 3 times every week. So the doctor said, you don't listen to my instructions, I don't want to take care of you. Is this right or wrong? Ethically and professionally, is it right? This patient is very bad, he doesn't listen. And because of that, he keeps coming to the hospital. Okay, so I think we'll stop here. The other scenarios are in the PowerPoint that you will be getting. Inshallah, you can read the scenarios, discuss them. And if you have a problem, Prof. Tahir can give you my email. You can send it to me and I can answer it, inshallah. So we'll now stop here. Wassalamu alaikum wa rahmatullahi wa barakatuh. Thank you for listening to me.
Wa alaikum assalam wa rahmatullahi wa barakatuh. Thank you very much, sir. Sir, people do have some few comments in the chat box. Would you kindly, they have responded to your questions by a couple of comments.
Okay.
Particularly the last one.
Okay.
Would you kindly respond to them?
Yeah. Dr. Waqar Qayyum made a comment, really, which I agree with, that we can take more time to do research simultaneously in hospital setting. He says that we can do both research and practice in the hospital setting. Okay. Prof. Muhammad Masood Khokhar said that we should make schedules and have protect time for research. Okay. But he says that about the patient who has MI and refuses to follow doctor's orders, we cannot refuse to treat him. And I agree with that. The patient is bad, he's disobedient, but we have to treat. Our duty is to save life. We can never refuse. Okay. And the physician should continue giving advice. You know, you cannot refuse to take care of people. Just give them advice and hope, inshallah, they will be compliant. So those are the comments we have in the chat. And
I had a question that when we talk of learning by apprenticeship and we talk of the hidden curriculum in the modern concepts, how this concept is comparable to the concept of suhbah and suhbat in Islamic tradition?
The correct approach is the suhbah, is the one in the Islamic tradition. So we need to make sure that apprenticeship in the modern sense follows the Islamic concept. We may need to change it a little bit. What does that mean? It means that the consultant, who is the mentor of the students, must be with them for a longer time. Lunchtime, they should go and eat together. Breakfast together. He should be with them all the time. Talk to them, listen to them, understand them, correct them. Because in the traditional way, the teacher was always there with the students. So most important, this constant suhbah enables the teacher to notice deviations or mistakes in the students to correct them quite early. That's what we need in the medical school. So if we follow the old system, we need to allocate students to some consultants, and the consultant takes time to be with them as much as possible.
Thank you very much, sir. If people have some more questions, we can have it in a couple of minutes, and then as professor would be busy, then we might have to conclude the session. To the audience, if people have some more questions, they may express themselves. A few more questions. Dr. Abdullah Muttaqi.
What about the truthfulness? The doctor said, if we do something wrong, how could we explain the wrong thing to the patient and attendant?
Yeah, that's very important. Part of our duty to the patient is full disclosure. We need to be open with them, transparent with them. Even our own mistakes, we need to be able to tell them. But of course, we need to know how to tell them. The Prophet ﷺ is a very good example. Remember in Medina, when he arrived in Medina, he found people grafting trees, dead trees, and he told them, no, stop. They stopped. So that year there was no crop. They came to him. Then he realized that no, that was not a correct thing. And he told them, please do what you used to do before, because I'm not an expert in agriculture. So the Prophet ﷺ admitted. So if he admitted, who are you not to admit to a patient that we made a mistake in the diagnosis, but that we have corrected it? We have found out we are doing this measure to do it right. And actually, many of us feel that telling patients will disturb them. It doesn't disturb them. They trust you more. They love you more because they know you are transparent. So ethics says that we should be transparent with our patients in everything, in the diagnosis, the treatment we are going to carry out, the side effects of the treatment, the advantages, everything we need to disclose, everything, except a few things that if disclosed right away could cause harm. We could delay the disclosure, but we can never hide information from our patients, and also we can never mislead them. This is ethics. Unfortunately, in many of our Muslim societies, we don't follow this. And in Western societies, they follow it. So this is a challenge, because this is supposed to be in our ethics, but we're not following it. So we need to change.
Thank you.
Thank you. Professor Abdullah, I hope it's clear.
Assalamu alaikum.
Wa alaikum salam.
Sir, may I have a question? Actually, sometimes there is a patient who has got a very serious medical issue, and life expectancy is, as per current evidence, is very limited. And the family members, they ask the consultants and the treating physicians, please don't tell the patient. Personally,
Yeah.
I think we should keep the patient informed in a very appropriate manner. But this is there's a lot of pressure from family members. Doctor, please don't tell him. He will be broken. Doctor, he will be depressed. Can you just give your comments on these situations, a very delicate situation where all family members, they say, please, doctor, don't tell him his diagnosis. He will be broken.
Yeah. I come across this a lot in Saudi Arabia. The family tell us, don't tell the patient. He will be depressed. Now, this is against ethics because the patient has the right to know. Remember, it is the patient who makes the decision. You need to tell him the procedure you want to do. He has to make a decision. He cannot decide without being told the information. So it's wrong to start with. But again, I have seen in Saudi Arabia, the patients are believers. You tell them you've got cancer. You tell them you're likely to die. This qadr Allah subhanahu wa ta'ala. I don't see them breaking down. It's the family that has this feeling. But many believing patients, they will accept the qadr of Allah subhanahu wa ta'ala very peacefully. And I've seen them accept this very peacefully. I don't know why the families think that the patient will be depressed. They don't get depressed. They accept. هذا ما قدر الله. So I think ethically we cannot listen to the families, and Islamically we cannot listen to them. Professionally we cannot listen to them because the patient must know his diagnosis in order to consent to our procedures. But there are some practical situations when the family are making too much noise. In that case, what I do, I ask the patient that, look, your family want to know about your condition. If you give us permission, we'll tell them. If you don't give us permission, we'll not tell them. So the patient may say, okay, you can tell my family, tell my sons. Or sometimes they tell you, okay, let my sons make the decision. So this way you can solve the problem. But if the patient says, no, I don't want my information given to the family, you don't tell the family. Or if the patient says, I want to know my information, you tell him, don't follow the family. You need to respect his autonomy.
Jazakumullah khair.
Is there any more questions? Sir, there is a question by the participant that if the person is not a strong believer, how would he approach the situation?
Yeah.
He has written this question in the chat box.
Oh.
That what about the believer or the patient who are not strong enough to handle the situation?
Yeah, of course. If the patient cannot handle it, and it happens because they are mentally labile, you may throw them into a problem. Yeah, then we don't have to tell them. We can tell them a little bit. We can tell them later, or we can ask them to allow us to tell the family. Yeah, but they have a right to know. But we need to use our wisdom to make sure that we do not create an immediate crisis, because sometimes you tell a patient that if you've got cancer, it's fatal. Within 3 months, he may jump out of the window of the hospital and die, commit suicide. So you need to use your judgment in such cases.
Professor Masood Khokhar has raised his hand. Probably he had. Sir Masood? Sir, with this, we come to the conclusion. On behalf of all the participants, I'm thankful to Professor Kasule for sparing time for us at this time, and I must also excuse to the participants for the inconvenience they might have had due to change in schedule at the last moment. And we hope to continue this, to have this continuation, to continue this interaction with Professor Kasule, and I would share his email with all the participants. Sir, if you allow me,
Yes.
can I share your email to the all participants that if they have some question, they can write it to you for the guidance. And I must also make one announcement that for the Riphah faculty, we will have one session in early part of July by Professor Omer Kasule Sab again. Sir, thank you very much, and thank you all participants. And sir, keep all of us in prayers. Thank you very much.
Jazakumullah khair. Assalamu alaikum wa rahmatullahi wa barakatuh.
Allah